Hi there, this is week 2 of my video series Acupuncturist at Home. My name is Catherine. I'm a registered acupuncturist practicing out of Canada. This series is about how I apply the TCM principles in my practice into my home and family life. I'm hoping that through this series I can help my clients practice some of my advice easier. Today I'm going to talk about a very common pediatric problem. My 5-year-old daughter has been struggling with her digestion since she was a baby. We've been successfully treating her intermittent constipation with Eastern medical principles for several months now, and I'm going to describe and explain how I use the tools that I use to help her. Now, before I explain anything, I do want to stress that she has idiopathic very mild constipation, which means that there is not an anatomical problem, there is not a disease that's giving her constipation. We have seen both a Western medical doctor and we've seen Eastern medical doctors as well, and we have it under control. Right now we're very much into the maintenance phase of her problems, which means that she doesn't have really constipation anymore, and I'm just trying to prevent it at this point. So if you or your child is afflicted with constipation, is having any problems, please go see a medical practitioner so that you can get an individual diagnosis and any special help that you could possibly need. So in TCM, there are several reasons, non-disease or anatomical related problems, that can cause constipation. And often for Western medical treatments, they use a daily laxative or a stool softener. They prescribe a high fiber diet or prescribe fiber supplements. Often magnesium supplements are included in a treatment plan, and also sometimes you can use suppositories to help move things along in your digestion. There are a few pathological possibilities according to TCM, but please, again, before you just decide that you can treat it with the things that I use, please visit a medical practitioner so that you can get an individual diagnosis and treatment plan. So often there is a dietary component in constipation. Not enough water, not enough high fiber food. Sometimes food allergies or sensitivities can be a trigger for constipation, or a diet that's too high in fat. Also, you can think about lifestyle problems or lifestyle triggers that you can be watching out for. For example, too much or too little exercise. Being too busy to really prioritize a bathroom break. Some kids are just super focused and they can't prioritize going to the bathroom over what they're doing right now. Sometimes it's also stress related. So if you have stresses in your life, you can think of that maybe as a trigger also. In my daughter's case, it seems that she just gets too wrapped up in her activities, and she doesn't think about going to the bathroom. So she's a very focused, artistic, diligent little girl, and she just gets wrapped up in her life. And once we figured out her TCM diagnosis, which in her case is a little bit of liver qi stagnation, we could take some time adjusting her diet and added in some specific massage techniques. Now in this video I'm going to talk about specifically what we used for her, and these are all general principles that will help anyone move stool. But if you do feel like you need more help than that, please go visit somebody who can help you figure out an individual treatment plan. But later in this video I'm going to show our Chinese massage or Tuina treatment plan, our little routine that we do after she has her bath. And so she'll be featured in this video receiving a little belly rub, and hopefully that'll help people out there who I know are also struggling with having their kids be regular and not constipated. So In terms of diet and lifestyle, we did add a daily probiotic to help her gut flora protect her belly and move more efficiently. She also has a daily green juice or a green smoothie, so I put lots of dark leafy greens in there with some fruit that also help move her bowels. The dark leafy greens are really high in magnesium, which is vital for the digestion and absorption for your macronutrients, and it also helps with protein storage in your body. So that's a very important dietary additive. If you're not getting enough magnesium, then definitely look into increasing magnesium-rich foods. Now, before you start on a magnesium supplement, please go and visit a medical doctor, because supplementation is challenging to get right sometimes. Now, she also has lots of stool softening fruits like pears and apples, mangoes, beets, and sweet potatoes. She doesn't prefer prunes, which are, of course, an excellent laxative, so it's just, for us, it's a personal preference thing, and we've found other fruits and vegetables that she prefers to prunes. We also added in flax seeds. We added in flax seeds to her oatmeal and cereals in the morning. Flaxseed is important for omega-3 fatty acids. It also lubricates your digestion, and they also contain plenty of bulk-building soluble fiber. If your child finds it hard to pass stool, it's painful, or it's slow, please use these suggestions, but also see someone to give you an individual diagnosis. The Tuena techniques that I'm going to use later on in this video are very, very gentle and can be used with for anyone who has difficulty passing stool. It is effective for infants and adults alike, so feel free to try these anytime you or your loved one feels backed up. So later on, when she's done her bath, I'll come back and show you what we do. You say hi?
Hi.
And how old you are?
I'm 5 years old. I have the baby sister named Adeline. And we are doing a video of Mommy lotioning me.
Yes, we're doing a video of Mommy lotioning her. So what we're going to start with is on the palm of her hand with a little bit of lotion. We're just going to rub around her palm. And every time you're going to do it for 30 to 50 or so circles. And of course, it's nice and firm, but it's not hurting, right, baby?
Right.
Right. Okay, and then the other one.
But why do we have to do a video?
Because I'm trying to teach people what we do that can make you help you poop when it's hard for you to poop. Is it sometimes hard for you to poop?
Yeah.
Yeah.
Really hard.
Yeah. So we've tried to do different things that'll help you poop, right?
Yeah.
Okay. Now we're going to move on to your little belly. So in order to make someone poop, in order to move the food through your belly, you're going to do it clockwise around your belly.
Clock.
I know, like a clock. Okay, so let's show the camera. You're just going to rub her whole belly. And again, it's the same. So it's clockwise, nice and firm, but not hurting. Right?
Right.
Love you.
I love you too.
Does that feel good? Do you sometimes toot when Mommy does this?
Yeah.
Yeah.
And it makes my belly look weird.
No. Okay. And then another thing that we're going to do is on this side of her pointer finger, you're going to push from the base of the finger to the tip of the finger. And again, you're going to do it 30 to 50 times, nice and hard.
But not hurting.
But not hurting.
And then another other finger. Doesn't matter which order you do them in.
No, but then we're going to do the other finger. Right?
Yeah.
Yeah. Okay.
But what about the thumb?
Sometimes we do your thumb, don't we? Sometimes we do the thumb from the tip of her thumb to the base of her thumb.
Yeah.
So you do it the opposite direction on her thumb. But today, we're just going to do your fingers. Okay? You want to do it as fast as you can do it. That other side, it was hard to do it fast because she was at a weird angle, but. And then are we going to do your back last?
Yeah. This one.
Okay. Now,
It's
when you do
easier
your
to
kids'
count
back, can you turn around, please, baby babe? This way? This way? Thank you. Okay. So when you do the back, the last one you're going to do is on her back, and you're going to go from just the tip of her spine right here down all the way to the bottom of her bottom. And you're going to go all the way down like that. And you're going to push nice and hard right down along her spine.
But not hurting.
Okay.
But don't hurt me.
No, I won't hurt you. Okay?
But don't hurt any of your child, even if they're rough. Not even if they're really rough. You can hurt them just a little bit, but not that much.
Does it hurt just a little bit?
Yeah.
Okay. Okay. And now that you're all rubbed and lotioned, you feel rubbed and lotioned? Are you looking at your shadow in the wall?
Yep.
Okay. So altogether, that was about 5 minutes that adds on to your after bath bedtime routine. For us, we really only do it either when she's having some trouble pooping or after baths. We don't try and do it every day or twice a day. Now, if you're having an attack, if you're having a lot of trouble pooping, then you can do it more often. You can do it several times a day if you want to, especially on the fingers and the thumbs where it's easy to access them. You don't have to sit rubbing their bellies the whole time. So that's how we are treating this little girl's belly. And is it working?
Yep.
Good. Can you say bye? See you next week.
Bye. See you next week.